Hello everyone. In this video, I will be sharing another US FDA new drug approval update. On February 20th, 2026, the US FDA granted a approval for a atypical antipsychotic therapy, Milsaperidone, brand name BYSANTI. BYSANTI is indicated for the treatment for schizophrenia in adults, as well as acute treatment for manic or mixed episode associated with bipolar I disorder in adults. Now, let's dive into this medication in more detail. Milsaperidone, brand name BYSANTI. This medication was approved by the US FDA on February 20th, 2026, and indicated for the treatment for schizophrenia in adults, as well as acute treatment for manic or mixed episode associated with bipolar I disorder in adults. Chemically, BYSANTI is an oral small molecule with benzoxazole and pyridine motifs. Molecule weight 428.5 gram per mole. Hydrogen bond acceptor 6. Hydrogen bond acceptor refers to the number of nitrogen and oxygen within the drug molecule. Hydrogen bond donor 1. Hydrogen bond donor refers to the number of OH and NH groups within the drug molecule. Log P 3.67, which is a lipophilicity parameter for the drug molecule. The higher log P, the more lipophilic drug molecule. Polar surface area 68 square angstrom. This medication is available as tablets. The strength of the tablets is 1 mg, 2 mg, 4 mg, 6 mg, 8 mg, 10 mg, and 12 mg with active pharmaceutical ingredients milsaperidone. Recommended dosage: take BYSANTI orally twice daily with or without food, and titrate BYSANTI to reduce the risk of orthostatic hypotension. Following the titration, recommended maintenance dosage for schizophrenia is 6 to 12 mg twice daily, and for bipolar mania is 12 mg twice daily. See full prescribing information for dosing details, including for patients who are CYP2D6 pro-metabolizers. Mechanistically, this medication works as a dopamine type 2, D2, and serotonin type 2, 5-HT2 antagonist, although the exact mechanism of action is unclear. Also note that milsaperidone is the reduced variant of iloperidone, and both agents rapidly interconvert in vivo. Pharmacokinetically, Tmax, the median time to reach the maximal plasma concentration is within 4 hours. Volume of distribution, it ranges from 1,715 to 2,343 liters. Protein binding is about 92%. Metabolism: milsaperidone undergoes oxidation to form iloperidone, which is further metabolized primarily by 3 biotransformation pathways: carbonyl reduction, hydroxylation mediated by CYP2D6, and O-demethylation mediated by CYP3A4. In CYP2D6 normal metabolizers, the observed mean elimination half-lives were 26 hours for milsaperidone, 18 hours for iloperidone. Excretion: based on excretion studies of iloperidone, In the urine, 58% for CYP2D6 normal metabolizers and 45% for CYP2D6 poor metabolizers. In the feces, 20% for CYP2D6 normal metabolizers and 22% for CYP2D6 poor metabolizers. Drug-drug interactions. Given milsaperidone is a substrate of CYP2D6 and CYP3A4 enzymes, strong CYP2D6 and or 3A4 inhibitors can increase the drug exposure of BYSANTI, therefore decrease the BYSANTI dosage accordingly. For patients requiring to take antihypertensive drugs, for example, alpha-adrenergic blocking agents, avoid concomitant use with BYSANTI and consider lowering the dosage of other antihypertensive drugs. Contraindications: known hypersensitivity to milsaperidone or the inactive ingredients in BYSANTI. The most common adverse effects, greater than or equal to 5%, for patients with schizophrenia, dizziness, dry mouth, fatigue, nasal congestion, orthostatic hypotension, somnolence, tachycardia, and increased weight. For patients with bipolar mania, tachycardia, dizziness, dry mouth, increased hepatic enzymes, nasal congestion, increased weight, hypotension, somnolence. Here are the key references which I have used to prepare for today's video. The US FDA New Drug Approval Updates for 2026 is a very valuable resource. In addition, most of the medication information which I share today is based on BYSANTI prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer websites. Finally, I want to thank you all so much for watching. If you found this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.